Hi everyone! Today I want to talk about a fascinating and really important episode from the Curbsiders podcast. This week, or that time, featuring Dr. Anisa Das. The topic at hand, it was about obesity, hyperventilation syndrome, or OHS for short. And it's a condition that doesn't get talked about enough, but can be really serious if missed. The case they open with is Mr. Pritwick, a 56-year-old man who used to be active until a knee injury slowed him down. Over the years, he gained weight and now has a BMI of 42. He showed up to the clinic feeling out of breath, tired during the day, and having frequent morning headaches. These symptoms raise concerns for OHS. So what exactly is OHS? Well, Dr. Das explained it like this. It's when a person with obesity doesn't breathe deeply enough, especially at night, leading to buildup of carbon dioxide and low oxygen levels. It's not just about weight. There are three things going on at once. The first being a resistance to leptin, a hormone that affects how we breathe. And the second is extra fat around the chest and belly that contributes to difficulty in breathing. And third is going to be a higher chance of obstructive sleep apnea, which causes repeated stops in breathing during sleep. Together, these make the lungs work less efficiently and cause chronic hypercapnia, which means that carbon dioxide builds up in the blood. To diagnose OHS, doctors look for three things: a BMI of over 30, a carbon dioxide level of over 45 on a blood gas test, and ruling out other causes like COPD or muscle weakness. Now, one big red flag is giving oxygen alone to someone with OHS, as Dr. Das strongly warns against this. It can make things worse by shutting down their natural drive to breathe, and instead the first line of treatment for stable patients is going to be usually CPAP, which is the same machine used for treating sleep apnea. But in the case of people who are really sick or hospitalized, doctors might start with BiPAP, which gives two pressures to help the lungs breathe in and out more easily. And the final fun fact, which was quite intriguing at first, is that playing the didgeridoo, yes, that instrument that makes the interesting noise, has been shown in studies to help with sleep apnea by strengthening the muscles in the upper airway. Finally, Dr. Das stresses the importance of weight loss, as even a 10% drop in weight can make a huge difference. And in some cases, bariatric surgery can actually cure OHS and get people off CPAP or BiPAP altogether. As primary care future clinicians, our role is to screen for this early, support patients through weight loss, and avoid respiratory depressants like alcohol and opioids, and to refer to specialists when needed. Thank you very much for listening this week, and I hope y'all enjoyed the summary of the podcast of the Curbsiders that we attended to and listened to this week. We'll see you next time. Bye-bye.